Good afternoon, and welcome to Series 3 of the Safe and Welcoming Schools webinar. We are excited to have Dr. Laurel Baer join us today to share her expertise on suicide awareness and prevention. To my colleague, Jewel Forbes, to formally introduce our speaker, Dr. Laurel Baer.
Thank you, Janice. Good afternoon, everyone, and thank you for joining us. Now, just a little bit about Dr. Laurel Baer. Dr. Laurel Baer was an educator in the Alhambra Unified School District for over 38 years. She has served in numerous positions such as teacher, dean of students, assistant principal, director of special education and student services, and prior to retiring in 2018 as the assistant superintendent of student employee welfare and student services. Dr. Baer has created, implemented, and operated the Alhambra Unified School District's Gateway to Success program. Gateway to Success was honored as a nationally recognized and school community-based mental health and safety program. Over 2,000 students yearly receive school-based mental health services because of this innovative and comprehensive program. Dr. Baer instituted and organized the collaboration of several critical partnerships in an effort to enhance school safety, as well as school-based service delivery of social, emotional learning for all students. I welcome Dr. Laurel Baer.
Thank you, Jewel, for such a kind introduction. I am absolutely honored to be speaking to the best of the best in education. I want to personally thank you for taking the time out of your very busy day to join this seminar. It further conveys to all of us how important your students are, not just to achieve academically, but also to be successful socially and emotionally, while helping your students continue to be safe from harm and risk. If you can go ahead and progress to the next slide. It is never too early to start reducing risk factors for suicide and increasing the protective factors for our children. Comprehensive approaches that support mental health, develop life skills, and promote the development of positive relationships with caring adults such as yourself may help protect children from suicide and support a healthy transition into adulthood. School districts across the country are increasing support for students' mental health to help students cope with stress as well as trauma. Along with the increased stressors brought on by COVID, schools are preparing a variety of measures for their students, as well as for our teachers and their classrooms. This includes focusing on social emotional learning. Next slide, please. It's important that you take care of yourself. And I know that sounds easier than done, but please make sure that you're able to step away if the topic becomes too difficult for you to take in and give yourself a little bit of a break. Self-care, if you need to take a moment, please do so. Next slide. Today's presentation is about mental health or well-being and suicide. So we want to begin briefly by offering just one simple definition, that is, what is mental health? Mental health refers to a person's condition regarding their emotional and psychological well-being. It is subjective and/or your personal feelings of contentment, happiness, and life satisfaction. The difficulty is that mental health can be affected by problems, challenges, crisis, relationships, as well as physical health, to name just a few examples. So it's important to recognize that all of these factors can affect how someone feels and how someone acts. Just like your physical health, your mental health is equally as important at every stage of life. And it is critical for you to nurture it as we nurture and take care of our physical health. Next slide. So we need to look at what impacts your mental health. There are many things that can challenge and impact your students' social emotional well-being. Could be life stressors, experience they have in the past or currently are experiencing, or even worries about the future. In addition to normal life stressors, our students are concerned about the current state of the pandemic, which has increased these stressors because daily activities that were once seen as being considered safe, like socializing with friends and loved ones, or even going to the grocery store, now has additional risk factors and may increase your students' anxiety. Stressors impact how your students feel, and it impacts their emotional well-being. Our experiences also impact your students' well-being and relationships. The experiences that they may have with their parents, with their family, how they attend to death, members or friends that are moving away, or perhaps they are relocating. This all impacts your students' well-being. And lastly, any changes or conditions in your students' physical health may add to your students' stress. And we know the pandemic has increased that. Now, many of these conditions may be unavoidable and unpredictable and out of our hands to intervene upon. However, it is important to recognize how they affect your students and how your students are feeling emotionally and how they are feeling towards others, because this ultimately affects how they think and how they believe. What we do know is life in its suffering does not mean that your students will have ill health or mental health issues, but rather the duration, as well as how long or to what extent they're experiencing sadness, anger, anxiety, depression, dissatisfaction can ultimately impact their well-being. If they continue to suffer without release or decrease in these strong emotions or experiences, it can impact their mental health and well-being. So let's go to the next slide and look at terms. There are no predictors of youth suicide, although the best predictor of future behavior is past behavior. So if a student has made an attempt before, there are a greater risk of attempting again. As such, it is important that I briefly define some of the common terms that you may not be familiar with, starting with self-harm. Anything a person does intentionally that can cause injury to self, including death, can fall under the definition of self-harm. If we look at suicidal ideation, ideation is thinking about, considering, or planning suicide. If we look at suicide attempt, it is when someone harms themselves with an intent to end their life, but does not die as a result of their actions. And finally, suicide is death caused by injury oneself with the intent to die. What is important to know is that we have to take every suicidal ideation or suicidal comment seriously, but also that everyone who says that they are sad or depressed or hopeless are not necessarily suicidal. Next slide. So now that I mentioned a few definitions connected to suicide, let's look at the connection between good mental health and suicide awareness. It is important to recognize that there is an interconnection between the two. On the one hand, good mental health can create protection from thoughts of suicide. And on the other hand, being aware of negative emotions can help you better understand what can lead to suicidal thoughts, which can impact your students' mental health. More will be mentioned later, but some things to be aware of is that thoughts and feelings, even those that express sadness, are normal. It's normal to feel frustration and experience challenges. Early intervention can prevent and exacerbate negative emotions. One of the first things you can try is to normalize what your student expresses. Some empathy should be demonstrated. So by simply starting a conversation and giving the student permission to talk about a difficult topic, whether it's about being sad, about a death of a grandparent, or having difficulties in school with their peers. This can help your students feel supported, that they don't have to go in this alone. Learning how to have difficult conversations as their teacher, as uncomfortable as those conversations might be, can create relief for your students, but it also can increase their coping skills, as well as helping your students access more support. This practice can decrease isolation and improve your students' well-being and even their academic performance, while helping your students build and improve their self-esteem, which is so important. So how can suicide awareness promote good mental health? Increasing awareness and educating others about signs and symptoms can help prevent future deaths by suicide. Our purpose is to inform you about the signs and symptoms in hopes that it is more that more people recognize what those suicidal signs are, and that more people can intervene before it's too late. Taking care of your own mental health is empowering. Learning how to manage will help your students feel in control and reinforce that they are capable in doing so as well. And modeling that behavior is critically important. Once their symptoms of distress are managed, they may be better able to tap into other strengths and get to know themselves in a new way. So as we look at that, let's look at some myths on the next slide. True or false? Think to yourself how you would answer this. If a student is really intent on killing themselves, there is nothing anybody can do to stop them. The answer is false. Do not underestimate a single interaction that you have with your student. Many times when suicidal youth find someone that gets them through their first crisis, they may turn to that person sometimes years later with when thoughts of suicide return. Not only should your students talk more, but society as a whole should help to end the stigma of talking about mental health as well as suicide. Let's look at another myth. If we talk about suicide, we may give students the idea to kill themselves. That myth is also false. Research shows that talking about suicide effectively lessens a young person's anxiety and does not put ideas into their heads. Let's look at another myth, or false or true, and that is those who talk about suicide are all talk and are just looking for attention. This is absolutely false. Most suicidal individuals do give warnings that they are in emotional pain and are thinking of hurting themselves. Even if they are seeking attention, they are doing so because they need to get help. They need to end the pain that they're feeling. And last myth, and extremely important, is the myth only experts can prevent suicide. And this is also false. You too can save a life. That is the purpose of this presentation, to provide you with information about suicide awareness and warning signs. You see your students probably more than their parents see them. And so your students are relying on you. Sometimes when a parent says he or she is just doing this for attention, the appropriate response is yes. And if we don't provide it now, wait to see what they may come up with next. So everyone, our adults, play a role with the prevention of suicide. How did this all come about? Let's talk a little bit about the legislative updates. The California Department of Education has been very supportive of suicide prevention efforts in schools and around the state. In 2014, a directive was given to your local school boards to establish a suicide prevention protocol. And in September 2016, the governor at the time, Jerry Brown, signed into law Assembly Bill 2246, which mandates that all schools servicing pupils 7th through 12th grade are to implement suicide prevention policies before the beginning of year 17-18. So many of you have received some type of preliminary training. Schools also implement state and federal mandates, which include Assembly Bill 2246 and then the more recent bill 1767. These two assembly bills mandate for suicide prevention policy to be in place on school campuses. Raising awareness about suicide and addressing the needs of high-risk groups is part of those mandates, along with the several other resources, and most important resource, the National Suicide Prevention Line, which is available 24/7, both weekends, after school, and before school. So let's take a little bit deeper dive on the next slide with Assembly Bill 2246. Because students spend a significant amount of their young life in school, our teachers, each of you who interact with them on a daily basis, are in a prime position to recognize the warning signs of suicide and make appropriate referrals when you identify. In September of 2016, the Senate passed the Assembly Bill 2246, which mandates all schools serving pupils 7th through 12th grade to implement suicide prevention, beginning in the year 17-18. So what Assembly Bill 2246 requires is the policy specifically address the needs of certain high-risk groups that are disproportionately affected by suicide. Youth who are members of these groups can be at elevated risk for suicide, but it's extremely important for you to recognize that just because your students may be in one of these groups does not necessarily mean that they are increased risk of suicide. Efforts should be targeted to address and reduce added stressors with youth who identify as part of these groups, in addition to all other students. And what you're going to see is that most of your students, just about every one of your students, falls into one of these groups. So let's break it down further. Youth exposed to suicide, and we're going to go back a moment to 2246. Youth exposed to suicide, previous attempts is strongly tied to future suicide. And that can be family history, but it also can increase their suicide risk if they've had a prior attempt, with risk of suicide among others within the family. It's important that those youth receive follow-up care, aftercare, and counseling if they're exposed to suicide. The second is depressed youth and youth with mental illness. It's important that you recognize that 1 in 4 youth have a mental health need as they enter kindergarten. However, the majority do not receive services. Effective treatment is extremely important, and that's why school-based therapy and mental health services within our schools is so critically important to save lives. If we look at alcohol and substance abuse youth, substance use is both chronic and acute risk factor for suicidal behavior, and the probability of suicide attempts increases with the severity of the substance use. In the US, more than 60% of youth report having used alcohol, 40% having used illicit drugs. So it's important that you recognize that those students involved in drug and alcohol use have an increased ideation of 10 times over their non-involved friends. Among youth who die by suicide, up to 75% met criteria for alcohol and substance use disorder. Substance abuse and suicide rates have both increased for teens. Alcohol abuse is also associated with greater frequency of more lethal suicide attempts. Alcohol intoxication exacerbates teen stress and their psychopathology and is associated with use of firearms. Substance abuse for teens often coexists with other disorders such as depression. If we look at the next category, bullies and victims is another risk factor. Children who have been bullied have reported a variety of behavioral and emotional social problems, but it's important to understand that those that serve as a bully are also at equal risk. And then our youth with disabilities. Individuals with learning disabilities were more at risk to attempt suicide than those without. Disabilities has long-term practical consequences and may be associated with mental health disorders, in particular with depressive disorders. So not surprisingly, youth diagnosed with mood, anxiety, disruptive behavior disorder are more prone to suicidal behavior. Additionally, adolescents with emotional disabilities were more than 6 times as likely to report suicide attempts. And then now look at our LGBTQ population. And we know that they're at increased risk for suicide as well. So if we look at our LGBT population, youth report a higher rate of suicide attempts. In fact, 62% are more than 2 times as likely to die by suicide than their heterosexual peers. If we move to the next category, and those are youth engaged in non-self-injurious behavior, we know that it's a maladaptive coping strategy. Suicidal risk increases with the number of years that youth engage in that self-injurious behavior and the methods they use. And then youth that are traumatized. And we know so many are youth returning back to school that have faced enormous trauma. But it's also important to recognize, as I said earlier, that 1 out of 4 children attending school has been exposed to a traumatic event, and that can affect learning and behavior. Trauma can impact not only school performance, but impact the experience that the students have with being able to attend to their emotional distress and physical distress. And then our youth who experience homelessness, or our youth that are in the foster care system. There are more than 400,000 youth in foster care system on an average day in the United States. Youth involved in the child welfare experience higher rates of mental illness as well as substance use and are at elevated risk for behavior. Foster youth are 3 times more likely to significantly consider suicide and 4 times more likely to have made a suicide attempt in the past 12 months, and 5 times more likely to be hospitalized following an attempt in comparison to their non-foster care youth. Foster care youth are 3 to 5 times more likely to die by suicide, and up to 1/3 of all youth suicides occur among youth involved in the child welfare system. So it's so important as you look at your student population that you're mindful that just about every student falls into a high-risk category. Next slide, please. So if we look at Assembly Bill 1767, basically it's an extension of 2246, which applies to local educational agencies, or as you refer to them as LEAs, serving students 7th through 12th grade, to add in 1767 groups from kindergarten through 6th grade. So this effectively mandates that every LEA is required serving students from kindergarten to 12th grade to adopt a policy on suicide prevention, also specifically addressing the needs of high-risk groups. Existing law requires that all public educations, kindergarten and grades 1 through 12 have a comprehensive school safety plan that includes suicide prevention. So if you have not had an opportunity to look at your district's school board policies and administrative regs, it's important that you're familiar with what your policies and plans are. If we go to the next slide, it just further emphasizes the case for policies and procedures. Maintaining a safe learning environment is critically important for our students. Promoting the behavioral health of students, which enhances their academic performance, and the impact of suicide on other students as well as the community. And then also, obviously, to avoid liability. It's also important to note that the California Education Code has a section addressing suicide in the Ed Code itself. So how do we build on this foundation? If we look at the next slide, it is important to build a strong foundation and that your district has strong suicide prevention policies, because what it really helps us do is it helps students at risk. And basically we know just about every student is at risk, provides staff education and training, provides parent education and training, and provides student education and training, because we need as many reliable gatekeepers as we can recruit. So what can be done? As we look at the next slide, we want to create systems to respond to suicide risk in the least restrictive environment. We want to know the warning signs. We want to ask directly about suicide. We want to screen for suicide risk levels, make safety plans and reduce access to lethal means when possible, create systems to respond to suicide in the least restrictive and least traumatizing way, connect to mental health professionals, and provide ongoing support for re-entry procedures and check-ins and safety plans. So how do we do all this in every day in your classroom? One way to begin to establish a good foundation, if we move to the next slide, is to, as educators, contribute to building our school community. And that is, we build upon student strength while integrating academic and social emotional success and coordinated efforts with a systematic integration universal level, which many of you are already doing in your classroom. School activities that focus on good health, prevention, positive youth development is extremely important, because these skills and strategies help your children and teens gain additional protective factors and reduce those risk factors that we spoke about. Effective SEL develops skills in problem solving, conflict resolution, nonviolent ways of handling disputes, as well as a sense of connectiveness or engagement, all of which serves as protective factors for your youth against suicide and other self-destructive behaviors. As teachers, it's important that you continue to develop the social and emotional competencies that are creative in a supportive and caring classroom environment. So if we move to the next slide, we want to look at the definition of resiliency because we know this is extremely important with suicide prevention. The quality of recovering quickly from failure and adversity, and not only returning to status quo, but actually using the opportunity to grow and further personal development demonstrates resiliency. We also know that evolving research finds that if we can teach these skills as young as elementary, then our students are better protected against the risk of suicide and other self-destructive behaviors. So let's look at key components in building resiliency. We talked about what is resiliency. It's the ability for your students to cope with stress. Resilience may look like being able to handle frustration or being able to find hope in times of hardship. We can learn how to increase resiliency by building connections with others, creating a supportive classroom environment, creating supportive systems of care, learning skills, and being able to help our students cope and manage with difficult emotions. Increasing awareness about suicide and good mental health will help your students build protective factors and increase their resiliency. What we know is that resiliency is extremely important. It is the ability to cope with stress, to bounce back from difficult situations when we fail, or try again if we fail. Resilience is what keeps us hoping. And the reason it is important is because it keeps us alive. Resilience can be asking for help, making new friends, building connections, and relying on others. This can come naturally, but oftentimes our students need to see this modeled. This is how we build on strengths of resiliency. Maybe you need to model it for your students at time, and maybe demonstrate to them something as simple as how to ask for help. This simple task will help your students start building the key components to being resilient. Some other key components are reaching out for support, building a routine in your classroom, putting structure or helping your students put structure in their life, making connections with others, particularly reliable adults, and supporting your students to learn and practice healthy coping skills. So how do we cope if we're talking about healthy coping skills? If we move to the next slide, stressors impact how your students think, feel, and what they do and how they act. Their thoughts affect how they're feeling and in turn, how they respond to you in your classroom. If your students develop skills that will help them consciously change their thoughts, then they can take some form of control over their feelings and beliefs and behaviors. Anxiety, for instance, typically stems from feeling like you're not in control. This skill can begin by helping students start by changing their thought pattern, perhaps creating a plan with your students, setting up a schedule with your students, being able to identify goals that your students want to accomplish, all assists in coping and managing. What do those common behaviors look like? This slide shows some behaviors to look out for and be aware of that might be a sign that something is up with your students. We know that behaviors stem from unmet needs. Communication doesn't always come easy for our students, and it is important to recognize that oftentimes your students' behaviors are meant to send a message about what is going on with them. These are some things you might want to think about or notice with your students. Look at anxiety, and it can vary from nail biting to irritability, to worrying, to headaches. Look for depression, more sad days than happy days. Remember, it's okay for kids to feel sad, but when their sad days outnumber their happy days, then that's where it brings some concern. A sense of hopelessness. That means that they have difficulty setting goals, not wanting to think or talk about the future. What we're trying to instill is a sense of hopefulness with our students. And then withdrawing, keeping to themselves, not going to family gatherings, not participating in extracurricular activities or typical activities. And then another common behavior may be aggression, picking fights, being argumentative, talking back in the classroom. These can all stem from frustration. Taking any or all of these behaviors seriously, if you notice a difference in the students that you've been working with, these behaviors become worrisome. You may be seeing something and receiving a different message than what your student's behavior demonstrates. If your student shuts down, for instance, and says, never mind, don't worry about it, how do you reopen your student to engage? Trust your instincts because you know your students best. So let's look at those risk factors. It is important to intervene when you can, or start communication early to prevent symptoms from getting worse. This slide shows some things to consider that might put your students at higher risk for suicide. Research has found that these factors are important to consider. Specific warning signs your students might exhibit if he or she are feeling suicidal. They may have untreated mental health disorders or physical issues, easy access to lethal means, alcohol or other substance disorders, lack of social support, a sense of isolation at times, have history of trauma or abuse, previous suicide attempt or attempts, family history of suicide, exposure to others who have died by suicide are all considered risk factors to be aware of. So what do you do as a classroom teacher when you are concerned? If we can move to the next slide. When you see a behavioral change in your students, not only does it provoke concern, but it can be very nerve-wracking and scary for yourself. As difficult as it may be, I encourage you to try to stay as calm as possible. Try to connect and engage with your students. Many times children can read your energy, and if they feel you can't handle the situation in regards to what they're going through, they may shut down and not share just out of fear itself. When you see a behavioral change that raises red flags, it's important for you to be able to connect with the student, meaning having an open dialogue, checking in with them and asking them how they're feeling. Being there for the student and connecting sometimes just means maybe sitting alongside of them. Silence in this case can be golden. It allows the student to internalize what is going on before they share with you. Then it provides you with a chance to listen wholeheartedly and carefully. Then you acknowledge them by validating their feelings and the information that they've shared with you. It's important that we listen carefully, and then you should ask in a very direct way if you're not clear, as scary as it may be, so you may want to practice some of these skills. Are you thinking about killing yourself? Or if you're looking for more clarification, you can ask something like, when you say, I don't want to be here anymore, what does that mean? Where would you want to be? The next action is to make sure that they are safe and that you keep yourself safe as well. Then, of course, get help. You want to connect with the resources that are available on your campus and the staff that are available to intervene on your campus. Specific resources will be provided in some additional slides. If we look at elementary on the next slide, high-risk considerations for elementary age students. You want to look at your district's data, your surveys, and the number of suicide screenings they may be facilitating on your elementary campuses. What we do know is that females are more likely to make attempts than males. Elementary considerations is that oftentimes our elementary kids will internalize behavior. Kids may not be as likely to share or identify as part of high-risk groups. For every suicide, there has been 25 attempts, meaning that we as educators have 25 opportunities to intervene. The most important opportunity could be the one you intervene on. So don't minimize, don't ignore, and take every threat seriously and differently. Take a good look at these warning signs that are indicated that need immediate risk, that may need immediate risk and intervention for suicide. The warning signs could be currently talking about suicide, giving away their treasured possessions, which look different than our adult treasured possessions, withdrawing from friends, a previous suicide attempts, signs of depression or sadness or hopelessness, increase in alcohol and drug use, preoccupation with death, dramatic change in personality and appearance and attendance and academic performance, perhaps a decline in energy, a loss of appetite, a lack of sleep, engaging in self-injurious behavior can all be considered risks for all youth and also for our elementary age youth. So as we look at suicide in younger kids on the next slide, what does suicide risk or mental health distress look like? For our younger kids, behaviors may vary widely. So we don't want to just categorize. They may have ideations, but not able to articulate clearly. Attempts might not appear as clear, may be masked by other behaviors, but the intent may be present. They may be aggressive. They may have ideations that they're not able to communicate, or it distracts them from doing well in school. So we want to look at the younger kids' suicidal risk levels, but also associate them with some of the other risk factors that I gave you for our middle school and high school age students. So if we look at other high-risk groups, I sit on the Child and Adolescent Suicide Death Review team. And what we have found when we look at the pathology of those that have taken their life by suicide is that oftentimes there's external factors, losses, family violence, sexual orientation, abuse, discipline, problems, bullying, impulsivity, other findings. So we don't want to just categorize one finding. We also see that those kids that are involved in dysfunction and loss, but also DCFS cases, high level of truancy, relationship loss and conflicts can be at risk. So when I started this earlier in the afternoon and said all of our students potentially can be at risk, you can see why we're seeing duplications in some of the categories that we described. If we move to the next slide and we looked at warning signs, you're going to see some of the same warning signs that we talked about earlier. Loss of interest and habits, change in appetite, giving away personal belongings, putting their affairs in order, but not talking about the future, withdrawing from friends and social activities or extracurricular activities, and not wanting to be alive versus wanting to deal with current issues. So let's look at poor mental health and suicide warning signs. Poor mental health is sudden changes in mood, the feeling like the student describes nothing matters, a sense of being numb. They have impaired functioning. They perhaps have problems or conflicts in relationships, whether it be with peer or family, struggling academically. We see a change or decline in their performance, even poor hygiene and health, and a change in their weekend activities or extracurricular activities. And then we look at suicidal warning signs. Intense feeling of being a burden to you as a teacher or to other adults, thinking of harming themselves or others, themes of death. When we look at journals and drawings and dying and wanting to die and looking at social media and perhaps posting on social media death, reading materials and discussions that bring us concern as our teacher, giving away again their possessions, and having plans means to follow through with it and access to what they might use. So for our elementary age students, we know that they may threaten to perhaps run into traffic, jumping from high places, cutting or scratching or marking or banging their heads. So we see a lot of these signs with a number of particular behaviors, but these also can be warning signs that someone's mental health is compromised, and it can ultimately lead to suicide. The list of symptoms that I've given you here are not a comprehensive list. And so it's important to note that's because they're not exhaustive, that we know that 1 out of 5 individuals suffer from mental health. And condition at this point is our job is to intervene. When we see something that doesn't seem typical with our students, we want to make sure we intervene. So if we look at those warning signs a little bit deeper, things that you may hear from your students: I can't do anything right. No one cares. I just want to disappear. I don't want to be here anymore. Everyone will be better without me. I can't keep doing this. I wish I could go to sleep and never wake up. I should just kill myself. I don't want to be here anymore. So we want to listen for those particular signs as well. And then if we're looking at talking to elementary age students, because we're going back and forth between elementary, preteen, and high school, they may use terms a little differently, such as hurting themselves, understanding different ways our students can articulate. Students may not be as complete or as thorough. As teachers, you need to be mindful about kids' engagement and their ability to be able to respond to you. Other options for communication, if they're not able to articulate, is perhaps you have them draw something, perhaps you have them color something, even a feeling thermometer where they can be able to rank where they're at to see what their level of need is and what interventions you may be able to recruit for them. As we talk about suicide, there are recommended languages that you should be using and modeling. And so if we go to the next slide, we want to make sure there's a couple of clear words that we use. So die by suicide or took their life as a result of suicide is much more effective and thoughtful than committed. Because when we talk about committing suicide, that's often associated with a crime, and suicide is not that. We also, as talking about suicide, would use the words attempted suicide, because there is no such thing as successful or unsuccessful suicide. Completed suicide would look different when somebody has taken their life. And then words to use, whether or not they're appropriate, we want to look at activating or content warning rather than a triggering. And that's important because we're seeing more and more so that using the word trigger can trigger negative thoughts and behaviors. So what causes an increase in thoughts and behaviors? In general, the more warning signs and risk factors, the higher the individual is at risk. What causes or increased thoughts of suicide? This is a list, but again, not an exhaustive list. Feeling hopelessness, impulsive or aggressive tendencies, loss of being rational, isolation, physical illness, barriers for students to be able to access their mental health, and their unwillingness to seek mental health. So when we see this, we need to know what to say. So if we look at the next slide, we're looking at talking about suicide is difficult for anyone. Knowing that your students' well-being is the most important aspect, you need to have these difficult conversations and create emotional safe space for your students to talk. You might need to ask yourself, how do I best engage with my student? On this slide, it provides with you a variety of different ways to invite a safe space for your students. It could involve engaging in an art activity, going for a walk, deciding to have a conversation that's very open-ended. And you want to make sure that you stay away from saying something like, you should, or why don't you? We really want to avoid judgment. If we look at how do we take care of your family and how do we take care of you, starts. Taking care of yourself is the same as taking care of your students. You cannot take care of others unless you care for yourself. You can't pour coffee from an empty cup. The same thing goes with taking care of your students. We know as adults, it's important that we're able to model a healthy role modeling for our students, and that we are able to take care of ourselves. And what this slide basically provides with you is a variety of different examples on how you can engage in self-care. And I know that's difficult, particularly with the demands that you have as a classroom teacher, but I encourage that you devote a small amount of time each week in activities that leave you feeling refreshed and that truly replenish your soul so that you're more effective and better able to take care of your students on a daily basis. It's important also to have support. So if we move to the next slide, connecting with others and having others in your corner is extremely important, particularly others that you can trust. And then this will help you manage those crisis situations. Having support either from your family, from your colleagues, from the school, from other members of the community will positively impact your overall well-being. So it's important that you recognize that connections to others will help develop a support system when you're working with students, and you will be able to do so in a meaningful way. It builds strength, it builds resiliency, and it improves your overall well-being. If you really would like to help your students find themselves in a different place, it's important that you're able to collaborate effectively, that you're not in this crisis alone. To help build strength and support systems, reach out to your colleagues, reach out to those individuals at your school sites that can provide additional support. And on your campuses, you have a variety of support. If we move to the next slide, I want to reiterate that you've got all these individuals that are trained in certain levels of mental health support. I want to reiterate that you make a huge difference for your students. And this is true in every situation of your students' life. They may not always remember what you taught them, but they'll never forget how you've made them feel. So it's essential that you're able to recruit the support and collaboration so that you're not doing this alone. All teachers want what's best in the best interest of their students. It can be so stressful when your students are struggling, and even harder when you have no idea how to help them or where to turn for support. So know that your schools can provide far more than just education. They are essential resources for non-academic support. Schools provide essential services, and most inclusively in this topic, mental health. Schools are a wonderful resource, and we want to make sure that you're able to access those resources as well. And schools have numerous mental health professionals that are available to not only support the students, but support the direction that you need to take with your students. So let's look at our school safeguards and know that you have a wealth of resources available for you on campus. It's also important that you know that schools do so much more than just ensure the student's safety. So the National Suicide Prevention Hotline number is extremely important because we know that those communities that promote the suicide hotline numbers have a lower rate of completed access suicide. You're the eyes for your students. You know their signs of stress better than anybody else. Engage in your students, do daily check-ins as well as check-outs. Social emotional curriculum is extremely important in your classroom. Building relationships and modeling those relationships are extremely important. And listen and provide support. Suicide prevention protocols are important that everybody has familiarity with that, as well as in-house resources. And then knowledge that you may not have all the answers, but that you can recruit the support you need. The Assembly bills have really helped facilitate a discussion in not only suicide prevention, but mental health. So let's transition from suicide awareness as we finalize our afternoon to suicide prevention. Now we have some awareness of suicide prevalence, risk factors, and warning signs, how thoughts may develop, and what schools are required to do. But it's also important that we know suicide is preventable. Every one of us has a role with suicide prevention. It's important for you to be familiar and versed in school with district policies, with procedures, and with protocols. And as we look at it for your students, if you leave with nothing else this afternoon, and if we can move to the next slide, you want to be there for your student. Being there is prevention. Just being there for someone can sometimes bring hope when all seems hopeless. Listen carefully to what they tell you. Active listening is extremely important. You don't have to have the answers. Acknowledge your students' feelings. Acknowledge how difficult it must be to be in their shoes. And be aware of your tone and your expression with your students. And don't advise or lecture or interrogate or judge. Simply listen. And I think that the Snoopy and Charlie Brown cartoon says it best. Being there is prevention. Just being there for someone can sometimes bring hope when all else seems hopeless. So let's find the words of what we can say. There are some ways and some examples of how we can start this conversation. And it may be something as difficult as, are you thinking about suicide? Or how often do you think about suicide? Have you been researching suicide online? Have you shared your thoughts about suicide with anyone else? Who can you talk to that can help you cope with suicidal thinking? If you can't find the words, simply ask your students, how can I help and where do you hurt? And that will begin a dialogue. And remember that silence is golden. So sitting and waiting for a response is extremely important. But in doing so, you're not in this alone. So if we move to the next slide, I want to reiterate how important community collaboration is. We all know how important community resources are. So before I review the list that we have, I want you to know that there are a lot of resources, that this list is not inclusive of all the places that you can go. But public mental health clinics, we have a number of those, over 85 of those in Los Angeles County are staffed and operated, and anybody can turn to them for help because they don't have insurance is not an effective way for them not to get help. They cannot be turned away. There's also a wealth of private mental health providers in every community. And then DMH has a well-being hotline. You may have formerly known that as the Access line. That is available 24/7, 365 days a year. And they can provide referrals, they can provide linkages for services within Los Angeles County. And of course, when there is imminent danger, if you're gravely concerned about the student that you're working with, please don't hesitate to contact 911. They work very closely with school districts to intervene and support the needs of students. If we move to the next slide, sharing resources with students is extremely important. Remember, talking about suicide does not increase the act. So if you or someone you know is in a suicidal crisis, we want to make sure that our students know that they need to seek immediate help from a trusting adult. Kids can't handle and attend to other kids' needs that are suicidal. It's important kids know where to go for help and how to ask for help. That's part of those protective factors and those resiliency skills, but also giving students permission that in the event that they're in imminent danger or need, that they also can call 911 or local emergency providers. And then also posting all over your district's websites and in classrooms and counseling offices, the National Suicide Prevention Lifeline. And you should have that programmed in your phone as well. Additional resources on the next line. We can move to the next slide. Students, staff, and parents can reach out to school counselors, school psychologists, mental health professionals who support students on a daily basis, but also that Suicide Prevention Lifeline. They don't need to be suicidal to call for help. You can refer them to this lifeline and they can call just if they need somebody to speak to. And as we wrap up this afternoon, I want to summarize some important concepts. In summary, there are 5 action steps in helping someone who is experiencing emotional pain. Ask, are you thinking about suicide? Then keep them safe. Reduce access to lethal means. Be there to listen and listen carefully. Help them connect. Suicide Prevention Lifeline. Listen to what they have to say. And probably most importantly is stay connected. Follow up with those students that you're concerned about or you've been working with. Stay in touch even after the crisis. And in doing so, we can assure you that you're going to be effective in preventing those students who may eventually take their life as a result of suicide. I want to thank you. I know this is a difficult topic, and I know at the end of a long day and in the middle of the week, it just adds to additional stress. And so I want to thank you for your time and open it up to any possible questions that you may have at this time before I turn it back over to our hosts.
Thank you, Dr. Baer. This is Susan Chides. If you have any questions or anything, you can go ahead and put them in the chat or any comments or anything. Dr. Baer has indicated that she's willing to stay over our time and answer any questions or discussions that you may have. You may put those in the chat or even specific questions in the Q&A. You may do that now. Thank you. There's a question about if you'd be willing to share the slides, and I think the slides will be available in the course module on campus that Dr. Phelps had reviewed at the beginning of our session. And so they would be available there, as well as the study guides and the other modules as well.
Absolutely.
So a lot of thank you for an excellent presentation, wonderful, some great and amazing information. So thank you for that. And a lot of thank yous for the presentation. Again, anytime you can put any comments or other questions or chat, that is fine at this time.
Thank you, Dr. Bear, for sharing your expertise. In closing, we would like to thank you for attending the live webinar for the All In Safe and Welcoming Schools series.